Premiers are putting up a united front, they say, against the government at this week's Council of the Federation, the Premiers meeting in Victoria. The issue, healthcare funding, which the government says will be tied to nominal GDP beyond 2017. That's economic growth plus inflation. Western premiers like BC's Christy Clark seemed fine with the change when it was announced that last month, but not anymore. Eastern premiers like Nova Scotia's Darrell Dexter, who was on this program, have come out against it. Today, though, there seem to be more together. They're rejecting what has been called a unilateral approach, calling it unacceptable and unprecedented. So, will the government reopen the discussion around the funding formula or not? Let's get some political perspective. From Victoria, the NDP health critic Libby Davies is here. From Toronto, Liberal health critic Hedy Fry is here. And in Ottawa, Alberta, Conservative MP, Parliamentary Secretary to the Environment Minister, Michelle Rempel is here. Good to see all of you. Michelle Rempel, let me start with you. Almost every premier said unprecedented and unacceptable. And what they didn't like was Jim Flaherty coming in and saying, here's the deal. No more discussion. Get on with it. Why take that unilateral approach?
Well, I think the exciting takeaway from this is that the provinces have clarity and they have stability in planning for healthcare over the next 5 to 10 years.
But they don't have a say in it. I mean, I know the government says it's clear and it's stable, but there was no dialogue, and it was clearly unprecedented. Why take the approach, if you wanted clarity, just to say, here's the deal, no discussion, walk away? I mean, does that help provincial-federal relations?
Well, I'm going to push back on the no dialogue assumption. You know, Minister Gluckak has been out talking to her counterparts quite, substantively over the last few months, but talking about how can we partner in innovation, how can we partner in, the priorities that provinces are setting. That discussion can now happen in the context of a stable, increasing funding formula for healthcare.
I got to just push back before I bring in, but the premiers have said, we never got a chance to talk about it.
Well, again, it's important to note here that in contrast to previous Liberal governments, we're not gutting the healthcare system. We're providing a stable, substantive, really substantive increase in healthcare funding to continue to ensure that Canada's healthcare system is one of the best in the world.
All right, let's bring in Hedy Fry on this, and I think we've got Libby Davies now as well. Hedy Fry, what do you make of that? The Premier's saying it's unacceptable, but the government said, look, we're still increasing the amount of money by far. We're extending the 6% escalator by 2 years. Plenty of time for adjustment. What's the problem here?
Well, the problem here is either you want to say to people, take it or leave it, and call that clarity, or you don't want to have people discuss anything with you at all to negotiate anything, and you call that the good way of running the federation. Either you want a top-down federalism or you want a cooperative, collaborative federalism. The 2004 Health Accord, and I'd like to say to Michelle that she should read it, because it did move in that direction. It did sit down and say to the premiers, we're in this together. We funded you stably. We gave you $41 billion with a 6% escalator until 2014. We, as a federal government, agreed we will collaborate and cooperate with you in 4 specific areas that will allow for transformative change, to deliver appropriate care where it should be delivered, to stop bottlenecking hospitals, to look at health human resources, to look at home care and community care, to look at pharmacare, which is always left.
But Hedy Fry, the problem is the government says you can't continue to deliver at 6%. They have extended that by 2 years because the economy is only growing at 4%. So yes. How do you do the math on that?
No. But the point here is they have the Conservative government increased that from 2014 for another 2 years in a bad fiscal time. The point isn't whether the 6% escalator is appropriate after 2014 or it isn't. The point here is that transformative change has to occur, and it can only occur if the federal government and the provincial government sit down together, work together to create innovation, work together to make it happen. And that does not bode well when you have a finance minister saying take it or leave it, you have a prime minister saying take it or leave it, and haven't met with the provinces at all since 2006.
Let's bring in Libby Davies just to get another perspective. Libby Davies, provinces say it's unacceptable. Stephen Harper telling Peter Mansbridge tonight, you can see it on the national, discussions are over here. Start talking about your own standards and innovation. What's the problem in your mind, if there is one, with the way this is proceeded?
Well, first of all, Evan, I'm actually here in Victoria where the Premier's conference is taking place, and it's been very interesting to hear the sort of what's going on in Victoria at the Premier's conference. And I think it's just absolutely unacceptable that Stephen Harper would play this game, because that's what he's trying to do, is create a scenario whereby he can sort of divide and conquer the provinces. The fact that they're not involved in any negotiations, that they laid down this unilateral decision, I think is pretty outrageous, and the Premier said so today. The chair of the conference came out and said in a very clear way that they were unanimously in agreement that what the federal government has done is absolutely unacceptable and unprecedented. And they also said that they want to have, you know, a national system. It's called Medicare. It's what Canadians are very proud of. I've never heard of a consultation where you basically don't talk to the other partner. That's what this federal government has done.
So let's,
and I think
let's
what we
get
have
to a
to
solution
say
then.
is that that Stephen Harper has to be accountable for the money that he has spent from the 2003-4 Accords. We need to have accountability for that, and we need to have the federal government being an active player, not walking away and abdicating their responsibility. I really, I mean, it's something that Canadians won't tolerate.
Well, let me get to some of the solutions here. One of the lines in the sand here, and Christy Clark raised it to me on CBC Radio's The House, is the per capita funding. She says, look, and she told this to the Prime Minister in their private meeting, unacceptable, cannot work with this because it punishes provinces with an older demographic. What she wants is an age-adjusted per capita investment, okay? Michelle Rempel, will the government negotiate on an age-adjusted per capita? There's one element of it. Is that on the table? Will the government talk about that?
You know, Evan, I think what Canadians want to hear, they want to stop hearing that this discussion is all about more money. What Canadians want to talk about is...
That's not more money. Age-adjusted per capita is just a more, she says, a more targeted way of distributing the existing money.
But what we're doing here is saying that we now have clarity in the financial system, how we're going to fund the healthcare system over the next 10 years. So, you know, as a young Canadian, I think we need to be talking about how do we innovate. And that's where the discussion needs to go. This is where our health minister...
But hold on just a second. That would be an innovation. Getting out of the per capita so you don't punish provinces that have an older demographic than a younger demographic. Would there be a discussion on that, for example? That's different than the escalator discussion. Is that on the table?
What's on the table is talking to premiers, talking to our health ministers, our counterparts, and saying, you know, what are your plans to innovate within your jurisdiction now that you have this stable, consistent source of funding, you know, out through the decade? And
so this is a no. I'm just reading. This is a no.
Well,
we're not negotiating.
You know, Evan, I think it's important also to talk about other things that the government does across the government to support healthcare innovation. You know, I worked in research and development for a big part of my career, and to see the innovations that's coming out of things like the Canadian Institute for Health Research, where you're looking at policy innovations in service delivery. These are things that we can partner with the provinces to do in a meaningful way.
Okay, so Hedy Fry wants to jump in. Yes. Hedy Fry, what about the age-adjusted per capita?
I want to jump in. I think looking at innovative things where we look at aging populations who need chronic care, that means they don't go into hospital. That means we need to do what we had promised to do as a federal government, and what this government has absolutely ignored, is to talk about home and community care. There was money put in for that innovation in 2004, and there has been nothing talked about further on it since 2006 with this government. You cannot talk about saying, I want innovation, as Michelle is saying, when you don't even want to talk to people. You have a top-down approach. You say, take it or leave it.
But just a second, do you want age-adjusted? Just a second, Hedy Fry, let's get here. Would the Liberals support an age-adjusted per capita?
I think we would support sitting down with the provinces, like we did with the 2004 Accord, which this government abandoned in 2006, and start doing some of the innovation we put money into.
You know, but the federal government did not say. The federal government did not.
Okay, hold on. Just in the spirit of time, let's go.
I'd like to finish my sentence.
Okay, let's Hedy Fry, you finish, and then Libby Davies.
I want to finish my sentence. In 2004, money was put in for innovation. We were supposed to work with the provinces on 4 areas, and we started to do that. They were co-chairing federal government and provinces on the 4 areas of innovation, which is pharmacare, home and community care, looking at e-health, and also looking at dealing with it. The federal government in 2006 reneged on it. They walked away from the table. They ignored it. This is a Canadian healthcare system,
you know,
not
the bottom line
provincial
is
healthcare systems. And you can't create that if you walk away from the table and then you bully people and become dictatorial in what you want to do.
Let me get Libby Davies here, and then we'll get Michelle Rempel. Libby Davies, age-adjusted per capita.
Evan, I would like to just add that I think, you know, there are some issues coming out of that 2004 accord. There were very few strings attached, and in fact, we've still got 2 years to go on that accord, and we need to make progress. So there's a whole issue of accountability of the federal government on that accord as well. But I think what's really happening here with this Premier's Conference and the whole debate around this issue of healthcare is that although the Conservatives may have a majority, and they may have that feeling of power that they have, but they've absolutely lost the high ground. I think everybody is saying.
But I need a solution. I mean, I know we're doing a lot of criticism. I just want to ask you, here's one solution that Christy Clark has talked about. Per capita, age-adjusted per capita. There's lots out there. Would you support that, Libby Davies?
That's something that the premiers have put forward, and that needs to be responded to by the federal government, because that's part of possibly a financial formula. That's what negotiation is about. The federal spending power has been a very important tool to make sure that our healthcare system can improve. The feds have given that away. The Conservatives have now given that away. So I think it's critical at this point that the Conservative government acknowledge that they've made a fatal mistake here. They need to go back and recognize that they have to sit down with the premiers, have a reasonable and fair discussion about the funding formula, see how they can meet the commitments from 2004 and be accountable for the $160 billion that was spent federally on healthcare, and then move into the new accord and what we can deliver there to states and Medicare.
I've got about 20 seconds. I want to give Michelle Rempel just a chance to respond real quick.
Well, you know, Evan, the number here is $40 billion. By the end of the decade, we'll have increased health transfer payments to $40 billion. Those are record levels. That's stability in funding that the provinces now have to plan over time to say how are we addressing issues like an aging population, et cetera, in our healthcare system. This is now where we want to partner with the provinces. We want to talk about, you know, within our scope of jurisdiction in the federal government, how do we support funding different initiatives, all those sorts of things through research and development, et cetera. But the bottom line is now we have stability and clarity and a long-term commitment to funding our publicly funded healthcare system.
But I guess the question is that stability, did it come at the cost of federal-provincial relations? And that's what we're trying to figure out here. Unfortunately, we have no more time to talk about that. We've been talking about it throughout the program. Michelle Rempel, Libby Davies, and Hedy Fry. I assume you'll be back to talk about this more. Thanks so much for that today. Lots coming up on our show, Power and Politics, including an update on the charges against that Canadian naval